Recording
So
in
you can
progress.
type your name. Remember, you can't type it before I record because it won't save the log. It's an actual log that only gets saved once the recording has started. Okay, so go ahead and retype it if you did type it before I just said I was starting the recording. We are on our final week of new material. Next week, we will not be having a live session because there is no new material. The final exam is going to be just on weeks 5 through 7. So at the beginning of week 8, in my announcement, I'll send a separate announcement at the beginning of week 8, in which I will attach week 5, 6, and 7 PowerPoints. So you can review those for the final. The final is only 50 questions. And this week's quiz, week 7 quiz, is 16 questions on reproductive and miscellaneous, in which we'll cover in tonight's live session. Any questions before I get started? Okay. Just give me a thumbs up, please, if you can see my PowerPoints before I get started. Make sure you can see these. Great. Okay. All right, so reproductive and miscellaneous here. We'll start with prostate cancer. Oops. Hold on. Prostate cancer is the second most common malignancy in men. It rarely occurs before 50 years of age, but the incidence will increase by about 40% with advancing age. So more common in men over 50. You can see some images here of prostate cancer. Cryptorchidism, it's a condition of undescended testes. It is more common in premature males. It can cause infertility, and malignancy is up to 40 times higher in the undescended than the descended testicle. There's a picture of it right up there. You see the arrow pointing to it. The undescended testes. Okay, testicular tumors. They're the most common neoplasms in men between ages 20 to 35. And unfortunately, almost all testicular tumors are malignant. Ovarian cyst, polycystic ovarian syndrome, PCOS. That's going to be characterized by multiple ovarian cysts, which may interfere with the physiology of the ovary. It is considered the most common genital disorder found in young women. That's an example of an ultrasound with ovarian cyst. A dermoid cyst, teratoma. This is the most common type of germ cell tumor. It contains skin, hair, teeth, and fatty elements. There's no clinical significance unless the cyst grows large enough to press on surrounding structures. You see a picture of it here. You see the teeth. Pretty crazy looking. Uterine fibroid. Uterine fibroids are a benign, smooth muscle tumor. They grow, they're stimulated by estrogen. So they're usually developed during those reproductive years when estrogen is high, and then they would start shrinking after menopause because of the lower estrogen. Abnormal bleeding between periods or excessive bleeding during periods is the most common symptom of uterine fibroid. Endometriosis, it's the presence of normal appearing endometrium in sites other than where it's normally supposed to be inside the uterus. Breast cancer is the most common malignancy among women between ages 44 and 50. It is the highest cause of cancer death in women. There is, if it's a stage 1 caught early, there's a 98% survival rate. That's why it's important to have mammograms yearly, starting your baseline at 40. If there's a family history, some will start at 35. If it's a close family history, like mother who had it young. But if you can catch the breast cancer in an early stage, stage 0, stage 1, then you have a 98% survival rate. A typical malignant tumor has poorly defined edges with areas of distortion, irregular margins, numerous linear strands or spiculas radiating out from the mass. Unfortunately, I just saw one of these today at work. I had a patient who was 78. She just came over from Cuba, so she's never had a mammogram in her life. Her left breast was very obviously deformed, half the size of the right because it was retracted in. She did not speak any English. She could not really communicate what these, even with translation. So there was really no history of how long it had been like that. And right away, I could see in her left breast all the speculation of the mass spread out. So that's poor survival rate for her because it is in advanced stages. So very important to get your mammogram at 40 and go yearly so you can catch something early. It's just a picture of mass there on the breast. Now, there's also benign breast diseases like fibrocystic disease. That's a very common benign condition occurring in 20% of premenopausal women. They'll have cyst size. Their cyst sizes changes with the menstrual cycle. So a lot of women will come in, they'll say they have a lump in their breast, but then it disappears, so it kind of comes and goes with their menstrual cycle. Right away, you already know that's a cyst if it's coming and going. So they will order a breast ultrasound for that as well, to determine if it is a cyst. A lot of fibrocystic breasts, the radiologist will recommend a breast ultrasound with it too, just to be able to read it better because they do have very dense breast. A fibroadenoma is a benign breast tumor, and that's benign, so it's going to have well-defined smooth margins, be more round or oval. You see it here. You see these borders, just circular, very benign. Ectopic pregnancy. This is a life-threatening condition, responsible for up to 1/4 of maternal deaths. Can be missed, and 95% of them are occurring in the fallopian tubes. Patient's going to be in an extreme amount of pain. All right, some vitamin deficiencies. We're just going to be concerned with these last ones here. Scurvy is a vitamin C deficiency. Rickets comes from a vitamin D deficiency. Night blindness is from vitamin A deficiency. And any excessive bleeding would be from a vitamin K deficiency. So very important to take your multivitamins. Melanoma. This is an extremely malignant skin cancer that can metastasize widely throughout the body. So you have to be very careful once you're diagnosed with melanoma or any type of skin cancer. It's always a good idea to follow with a dermatologist every 6 months, sometimes even every 3 months, for a full body mole check so they can catch any type of skin cancer in its early stage, because melanoma that is not caught will spread throughout the whole body, metastasize. It develops from a benign mole, which then starts changing size and color, and can become itchy and sore. And muscular dystrophy. This is a group of chronic inherited conditions in which the fat replaces muscle. So unfortunately, patients with this have a very hard time walking and moving around because of the loss of muscle. Okay, that is it for this week's PowerPoints for the quiz. Let's see, any questions? I see some questions in the chat. Nope, final's only going to be week 5 through 7 since the midterm covered the first. Oh, sorry. Jeez. Sorry, and my dog in the room. Since the midterm covered the beginning, the final will only be 5 through 7. Any other questions? Okay. All right, great. So no other questions. Remember, you have your normal stuff this week, your discussion board assignments, and your 16-question quiz for week 7 based on these PowerPoints. And then, like I said, I will upload the 5, 6, and 7 at the beginning of week 8. I'll post it in an announcement for you guys to review to get ready for the final. But this is your last week of new material, so you're right at the end. All right. If you have no other questions, then have a good night. And remember, you can always email me if you have any questions throughout the week. Thank you. Have a good night.